We'll get started. Welcome. Thank you very much for your interest in this topic. My name is Tom Van Hoof. I'm a faculty member at the University of Connecticut. And for most of my career, I've been very involved in continuing education, continuing professional development. And in the past 10 years, I've immersed myself in this emerging interdisciplinary field of the science of learning, or learning science. And one of the areas that I've just become fascinated with and slightly terrified, given my own past history of not getting adequate sleep, but the relevance of sleep and its connection to the biology of learning and its implications on continuing professional development. Whether we're planning a CPD event or we're attending one, sleep is incredibly important, and to a large extent, the biology of learning explains why. So I'm going to describe in kind of oversimplified version of the 3 biological steps involved in learning and memory, talk about 4 benefits associated with a full night's sleep, and talk a little bit about the implications of sleep to planning continuing professional development activities. So 3 basic steps of learning, and again, this is oversimplified, and these are absolutely critical. In sleep, I'll mention the role sleep has, and we'll talk more about sleep subsequently, but I'll mention a little bit about sleep as they relate to these steps, the first 2 steps in particular. So I'm going to hold in my hand for a moment. This is an EpiPen. I have a peanut allergy, but that's not important right now. But I have this on my desk, so I grab this, and I'm to illustrate encoding, which I'm sure people are familiar with, but ask you, if you would, to take a look at this EpiPen. Maybe just the color scheme. I know you can't see the writing on it, or at least I can't. But take a look at this EpiPen, if you would, and close your eyes and picture it. So take a moment, close your eyes, and picture the EpiPen as best you can. So open your eyes, and hopefully, if you were able to visualize that EpiPen, maybe not in a lot of detail, but certainly in some detail. That's an example of encoding. Encoding is bringing something, and I hope we can all agree that this is outside our brain, right? But a remarkable thing happened when we looked at this, we focused on it, and we recreated that image in our working memory, part of short-term memory. It's a remarkable feat. And essentially what's happened, as you know, is that the brain, there's a set of neurons that have been activated. And when we reactivate them, if we close our eyes and picture it again, we're getting that set of neurons to fire again. And so it's a temporary representation of something important. It could be knowledge, skills, attitudes, ideas, beliefs. But that first step of learning is bringing something in temporarily to our working memory. Now, from the standpoint of sleep, and Dr. Snyder mentioned this early in the keynote, he mentioned, being present. Our ability to be present, in part, is predicated on our being able to focus and being able to concentrate. And sleep is really critical to our ability to focus and grasp something, particularly something new or complex that we're learning. So sleep is critical to prepare the brain to learn, and encoding is a critical aspect of that process. So, okay, so now we've got this. This isn't important, right? But now we've encoded something. We've done something. We're working with it in working memory. The next step we call consolidation. Now, consolidation is a step where we're ideally moving something that's important from our working memory to long-term memory. Because long-term memory is really where it's at with respect to learning and memory. And so typically the things that our brain moves, essentially processes and tries to move to long-term memory, those are things that we spend a lot of effort on, right? So the brain is, recognizing that this has got this knowledge or this skill has gotten a lot of our attention today, And so it'll devote resources to it and deem it to be important for additional processing. The other things that we tend to consolidate are things with significant emotional valence. Something really good, something really bad. Our brain tends to remember or try to move those things. So the next step in learning, so we brought something in temporarily. If our brain deems it to be important, we begin to process it right away. But ultimately, when we take a cognitive break, and the best cognitive break, as you can guess, is a full night's rest. That's when the brain does a lot of processing and moving things that it deems important from working memory to long-term memory. So that step is really critical. Anything we spent time on, we want to move that, if it's important, to our long-term memory. And cognitive breaks, when we're no longer thinking about those things, interestingly, that's when the brain makes a lot of progress. So often people refer to sleep as a learning activity, and in fact it is, just not in the traditional sense. So we brought something in temporarily. If the brain deemed it to be important and we take a cognitive break, and we've given our brain a chance to process through a full night's rest in particular, we may have consolidated something. Now, the third step, we used to think is just a way of accessing information, but not really contributing to mastery and memory. But I've been impressed that retrieval, this third step, is when we're going to our long-term memory and we're bringing down something we worked on previously. We studied something previously. We've practiced something previously, bringing it back down, essentially re-encoding that information. And essentially what we're doing when we retrieve is we're trying to get that neural network, that neural ensemble to fire again together. By doing so, we're telling our brain it's important. Again, and the brain then will be more likely to devote more resources to this. So so retrieval is not just accessing things we've learned, it's actually improving our memory, our mastery, and our memory for that information. The more iterative cycles of encoding, consolidation, and retrieving we do with information, the more likely it is that we'll master it, and the more likely it is we'll remember it. And as I've mentioned, sleep is critical to encoding as well as consolidation. I'll just pause there to see if people had any questions. I'll ask Elisa if she saw anything in the chat.
Not at this time, no.
Thank you. So this is a hypnogram. You might recognize this. This is a graph of what phases and stages of sleep a person might go through. Not to get into a lot of details here, but I want to point out, as you know, there's two phases of sleep. There's REM sleep, rapid eye movement, and then there's NREM, non-rapid eye movement sleep. Another more recent system has just 3 stages in NREM, but nonetheless, our brain, when we're sleeping and we get a full night's rest, importantly, we spend time in REM as well as in NREM, and in particular with NREM, because it's got multiple stages, deep sleep or slow wave sleep, and in this system, it's stages 3 and 4. But we're spending time in a full night's rest, ideally getting both REM and NREM. Now, a subsequent slide will break down the benefits of sleep by these phases, but my point here is just showing you that if we look at the first half of the night sleep here, much of it, proportionally more, is spent in NREM than in REM, very little in REM, right? And in the latter half of the night, we're spending proportionately, typically, not exclusively, but more time in REM than in NREM. Both are important to learning and memory and to health, but now the other point here is that when we don't get an adequate night's sleep, whatever it is we need to feel rested, when we don't get an adequate night's sleep, we're generally compromising the amount of REM sleep that we get, because we might get a few hours and we're going to proportionally get that in NREM, and that's important. Restorative or slow wave sleep is important, but we're often compromising the amount of REM sleep, the quantity and the quality of it. So getting a full night's rest, that cognitive break that's critical to consolidation, is really important. And so the emphasis is really on getting as predictable, and it's a challenge, of course, but it's getting on a regular basis a full night's rest, because that's when we capitalize on the efforts we made to learn in the day prior. So some benefits of NREM and REM sleep. You can see that these are 4 benefits of sleep. In NREM, it's thought that we strengthen existing memory. So things we know already and we might reuse or reconsider, NREM will devote resources to stabilize or continue to stabilize the synapses that relate to that information. Also happens during NREM, but also in REM, but we're preparing our brain for new learning. We're removing neurometabolic waste from the day prior. The thinking activities we've done, we've got to remove the breakdown of that neural activity, and we've got to distribute, important molecules, glucose, neurotransmitters, and the like, lipids. We've got to move those to areas that have been highly utilized to replenish the stores. So NREM sleep is great to strengthen existing information that we know and to prepare our brain for encoding the next day. REM sleep, as a complement to this, helps us to connect things we're learning with things we already know, assimilating new information. NREM is really important for that function. The other function that's really important is creative problem solving. We've all had the circumstance where we're struggling with a challenge. Maybe we get a full night's rest if we're lucky, and we have some insights the next day. Well, it's likely that happened during REM, and if we didn't get a full night's rest, it's possible we wouldn't have made some novel connections or novel associations. So both of these phases are really important for overlapping, but in some unique reasons as well. So a full night's rest is critical to the biology of learning, and then to in the context of continuing professional development, for sure. A little bit more about the biology. As you know, the central nervous system does not have a lymphatic system like the rest of the body. It has a glymphatic, that is, it refers to, the G is for glial cells. And so when we're sleeping, about 90% of the cleanup happens when we're sleeping. There's some cleanup during the day, but our brain really needs sleep is often required to clear the waste and distribute non-waste compounds. And there are many support cells. Neurons are important, but here's an astrocyte just to make, again, for me, if I think about the biology of learning, it helps me to make better decisions about planning educational activities and about learning myself and continuing professional development activities. So one of the things, astrocytes or astroglial cells are really critical and are very active while we're sleeping. Here you see this is a blood vessel early. This is postnatal day 0, actually. And this astrocyte, this vascular end foot, is beginning to cover this blood vessel, because astroglial cells influence blood flow. They also can envelop the synapses, the connections between cells that are critical for these neural networks. And so they're very involved in controlling and influencing synaptic connections. And so these cells are very active while we're sleeping. A lot happens while we're sleeping, as you know, and it's increasingly recognized how important other cells, not just neurons, but also traditionally called, support cells like astrocytes and microglia and oligodendrocytes are really critical, because learning is a biological process. As remarkable as our brain is, and somewhat mysterious for sure, it continues to be mysterious, it ultimately is biological. And if we don't treat it that way, we don't take care of ourselves, we don't get regular rest, our brain won't function the way it's designed to function. Just a point here, again, this cognitive break is one of the reasons that distributed practice or distributed learning or spacing has such a rich history of being an effective strategy, because our brain, interestingly, needs time when we're not thinking about what we were just trying to learn. We need those cognitive breaks in order to process information. We can't just keep working at something, although we sometimes do this, but we should stop and give our brain a chance to process things. And there's a rich history associated with distributed practice, which makes the case. This visual image was from a grant we had with some colleagues in engineering. We created these visual images representing 4 strategies of the science of learning that are most effective. But this brain character we created is preparing for a piano audition, a concert pianist position. And the character is devoting, somewhat arbitrarily, 4.5 hours to practice, rather than practice for 4.5 hours the day before the session, which would give potentially 1 cycle of encoding, consolidation, retrieval. The characters decided to spend 9 30-minute sessions separated by a full night's rest. 9 iterative cycles of encoding, consolidation, retrieval are far superior than 1 intensive, lengthy practice session. So distributed practice is wonderful, and one of the reasons it's wonderful because it typically comes with the cognitive breaks and rest and a full night's sleep that's so important to learning and memory. I'll pause there again. Just Lisa, let me know if there are any questions in the chat. If not, this is my last slide, and then we can open it up for discussion.
Yes, we have a question. What impact does exposure to screens or screen time prior to sleep have on REM sleep? Are there clear implications for diminishing the ability to learn?
Yeah, good question. We definitely want to prepare ourselves to sleep, and sleep latency, or the time it takes for us to fall asleep, is important both to NREM and then to REM, especially if we're going to wake up at a predicted time. That is, we're not going to just let ourselves sleep until our brain naturally wakes up. We're going to set our alarm. And so what I would say about screen time is that, if we're doing a lot of stimulation, particularly, blue light tells our brain, it's daytime, be alert, be awake. So if we can decrease that, typically we're preparing our brain, we're beginning to relax and prepare ourselves to be able to fall asleep. And the faster we fall asleep, the more NREM and then REM sleep we will probably get. And so there might be more to it, but that's my understanding. At least I'll give this question some more thought and see what else I can learn. But I think it's more of an issue of getting to sleep and sleeping, as the quantity and quality of sleep being as good as it can to benefit from the processing that happens in both phases of sleep. Hope that helps. Thank you very much.
We have one additional question. That
super.
Are there specific activities that are recommended during a cognitive break?
Oh, yeah, good question. Generally, the key thing is not thinking about the thing you were working on. So it's great if you can, maybe take a break where you're not doing anything cognitively taxing, like, a meal or a walk or meditation, something to kind of allow the brain to clear what's in working memory and not bombard it with a lot of stimuli. But even if one has, and I do this all the time, and you all probably do this, if I get stuck on something, I'll move to something else, and then I'll come back to the thing I was working on. So I did take a cognitive break from the task A, but I didn't take a break in the sense of allowing, my brain to relax. but it still was a break from, when I'm working on content B, checking emails or doing something maybe that doesn't require a lot of thinking. Then I go back to A, I find that I might, have some new insights. I might feel a little more refreshed to continue to make effort in that area. So small amounts of breaks, 5 minutes and the like, are a great way. And you can move to something else if you just don't have the luxury of taking a break. But meals, exercise, meditation, a full night's rest, and again, full night's rest is really the plan A for all of us in terms of being the best cognitive break. I hope that answers the question. So in continuing professional development, we're planning, you'll see here, there's a reference here at the bottom. We recently published an article. We made kind of a provocative pitch for issuing credits, continuing ed credits, directly or indirectly for sleep for educational activities that we offer continuing education credits for. We do that to make the point of how important sleep is, but I know that I underappreciated the importance of sleep, particularly with learning and memory. So I think with our continuing education activities, we should, as much as possible, have some brief conversations and make recommendations about getting a good night's rest before a continuing education activity to the extent we can. So we're prepared to learn. We can do a much better job of encoding, and maybe encoding for longer and with more attention to detail. And we should tell people about how important it is to get a full night's rest after a day of learning so that we consolidate as much as we can, and maybe avoiding caffeine late in the day so we fall asleep faster, maybe avoiding alcohol entirely, which can interfere, with REM sleep. So I'm talking about the things that influence sleep and doing what we can. We should also, as planners, not plan early day events, not plan late night events. So we give people an opportunity, increase the likelihood people, we'll do what we need to do, of course, but we increase the likelihood that people will sleep or get a full night's rest. And we, again, recommend that to people and tell them why it is that's so important. And also one final thing is that using pre-activities and post-activities, even if we have a learning event like a course or a conference or a symposium or grand rounds, if we can get people to think about the content a day or more before, so there's a full night's rest at least or more in between the event proper, and then there's some follow-up with a post-activity, then what we're creating, though, is a more longitudinal experience with sleep involved, and iterative cycles, again, of encoding, consolidation, and retrieval, benefiting from a full night's rest. So I hope that, I know very brief, but I hope that the discussion about the biological steps and the benefits, as well as some ideas about planning, were helpful. And I'm certainly happy to correspond or talk with anybody about this in more detail. But